health and a little wealth and a lot of love.
It's something that I think there's a misconception if it's on the shelves, if it's at a health food store, if it's in a supplement bottle, that it's got to be regulated, it's got to be safe to take, and that is certainly not the case. There have been plenty of people who've had liver failure and kidney failure from taking some of these supplements.
That's right.
And I think a good resource, there's an app and a website called About Herbs that was created by Memorial Sloan Kettering, which is a famous cancer center, that has a list of a lot of the most famous supplements or herbal, herbs or herbal supplements that you could take. And it has a breakdown of not only...
And we're not sponsored by them, by the way.
We're not. But it's something that I used in practice, something that can be helpful if I had a patient that said, I'm taking this, and a lot of times you've never heard of it before.
Mm-hmm.
And they ask, are there any risks with taking this? Can it potentially help? Is it something that's going to interact with the medications that I'm on? And it really has a great database that shows you what are the clinical studies that they've done to show, is this actually clinically helpful? What are things that it's used for?
I didn't know that.
What are side effects? What are potential, and they have case studies too of people. It might not be a high number of people who've had issues, but it also talks about medication interactions. And so that is something that everybody has access to. It has a clinician's section. It also has the consumer section. So it kind of goes more in depth for the providers that are reading it. And gives a little bit more in layman's terms for the consumer. But I think that's a good start if you're a little bit curious.
Yeah. Well, this is what I would say to people. So if you are listening to this podcast and you are hearing this about a medicine reconciliation, drop us a line. Ask us a question. Like, let us know. Is it your parents, your grandparents? Is it you that you probably want to understand the medicine reconciliation? Right now that we are a little smaller, so if you are watching this a year or 2 years from now, we don't know where this journey is going to go. This probably won't apply, but we want to hear from you guys. Is this something that you are interested in doing? So we're trying to figure out over time, like, what product and services can we offer folks, not to taint this, because this will always be free information. We really want to help people, but what other things can we do to supplement this podcast for people to take quality information to better their health?
With a little health and a little wealth and a lot of love, that's a life that we live. Suits and scrubs.